Good afternoon, my lord.
Good afternoon, Miss van der Vestes. Now, we have a panel this afternoon, I believe.
We do, my lord. We have a panel of representatives of two organisations that are members of the Scottish Refugee Council. We have Mr. Anil Singh Bhopal, who is Deputy Chief Executive of West of Scotland Regional Equality Council, or WESREC. And we have Ms. Rebecca Dadge, who's currently a volunteer with Forth Valley Welcome.
Very good. Good afternoon, Mr. Bhopal and Miss Dadge, I beg your pardon.
Hi.
Right. There will be some questions for you, so I will just pass over now.
Thank you, my lord. Before we start, if I could please remind you both that the proceedings are being transcribed, and if you could please speak slowly and clearly, and I'll try to remember to do the same. I'll start by asking you each in turn to confirm, please, your full names, the name of the organisation you represent, and your roles both now and during the pandemic. And perhaps we can start with Mr. Bhopal, followed by Ms. Dadge.
Yeah, so my name is Anil Singh Bhopal. I currently work as the Deputy Chief Executive Officer for the West of Scotland Regional Equality Council, or more commonly referred to as WESREC. During the pandemic, I was working part-time with WESREC and also part-time with the Scottish Refugee Council as one of their regional integration coordinators for the southwest of Scotland, so supporting communities working with refugees and asylum seekers across 9 local authorities in the southwest of Scotland.
Thank you very much. And Ms. Dadge.
Hi, so I am here as a volunteer for Forth Valley Welcome, which is a small charity that supports New Scots refugees across Stirling and Clackmannanshire. At the time of the pandemic, I was the manager of that organisation.
Thank you. You both previously attended a roundtable meeting with other organisations that were members of the Scottish Refugee Council and the inquiry team, and that report has been approved. My lord, for reference, that can be found under SCI-WT0205-000001. The intention today is for His Lordship to hear about some of the key issues and impacts experienced by the organisations you represent and the groups and individuals they support under a number of broad themes. Before I outline those themes, could I please ask you each to provide a brief overview of the organisations that you represent, including their usual or non-pandemic roles, the types of work they ordinarily carry out, and the groups or individuals that they normally support or represent. And perhaps if we can start with Mr. Bhopal again, followed by Ms. Dadge.
Yeah, so I work for the West of Scotland Regional Equality Council. We are an equalities and human rights charity based in Glasgow. We cover Glasgow as part of our remit, but we also work across 11 other local authorities across the West of Scotland to support people from minority ethnic communities, including refugees, asylum seekers and new migrants. So we run several initiatives to support communities that vary in terms of theme. Our project work covers employability, health and well-being, community development, and we also deliver a lot of casework support for victims of hate crime and discrimination. During the pandemic, I worked for the Scottish Refugee Council, who are Scotland's national refugee charity. Every year they support thousands of men, women and children as they rebuild their lives in Scotland, and they provide direct support and advice services, promoting community integration, and they stand up for refugee rights and campaign for a more fair, humane asylum system in Scotland.
Thank you very much. And Ms. Dadge.
So Forth Valley Welcome supports refugees coming into Stirling and Clackmannanshire in a variety of ways. At the time of the pandemic, we had 2 members of staff, so it's a very small charity, and about 70 to 80 volunteers, and we support them in various ways. So we often provide befrienders for families to help them integrate into the areas, show them how things work, show them where they can get food that they like, just be a friendly face, informal English practice. We put on events for them, again around English practice or just outings to keep them entertained and show them what areas of interest there are in local authority areas. We supply them with material needs above and beyond what the council might supply, again to make their house more homey or find things that they like rather than what are chosen for them, toys for the children, small household items, small electrical items, all of that kind of stuff, and that's all done with the support of the volunteers. Do a lot of, particularly when they first arrive, of taking them to medical appointments. Quite a few have health issues, so we do all that kind of support work around the families.
Thank you very much. Time permitting, I propose to have a discussion around issues and impacts under the following broad themes. There's quite a bit to get through, but if we don't finish everything, we do have the the roundtable report, so all of those impacts will be taken into account. But time permitting, the following broad themes are refugees, asylum seekers and New Scots. Secondly, organisational adaptations and role of your organisations during the pandemic. Thirdly, issues around digital inclusion. Fourthly, issues in relation to access to food and other essentials. Fifthly, particular challenges for single parents or other groups. Sixthly, communication of pandemic information. Seventhly, collaborative working and community connections. Eighthly, financial support and access to that. And finally, potential lessons to be learned. So if we could perhaps start with the first broad theme, refugees, asylum seekers and New Scots, and really just try and, for His Lordship's benefit, get some background information relating to refugees, asylum seekers and New Scots, including, for example, the types of issues they experienced before coming to the UK, pre-existing inequalities and issues experienced pre-pandemic, for example, financial, mental health, social, language, etc., just in very general terms, and also the distinction between the rights of asylum seekers compared with refugees, and any other relevant key issues in terms of how different groups or how there are distinctions between different groups within those that you support. But perhaps we can start by just having a brief discussion about the types of issues that those you support experienced before coming to the UK, and perhaps we can start again with Mr. Bhopal, followed by Ms. Dodge, and we'll swap about in due course.
Thank you. So many of the people that we work with seeking asylum or are here with confirmed refugee status will have fled countries where they will have directly or indirectly experienced war, violence, persecution and torture. So a lot of people that come to our country seeking asylum or seeking refuge experience not just one single trauma but hundreds of traumas. And just to give you a bit of background information into what constitutes being a refugee under the 1951 United Nations Refugee Convention. A refugee is defined as a person who is unable or unwilling to return to their country of origin owing to a well-founded fear of being persecuted for reasons of race, religion, nationality, membership of a particular social group or political opinion. So in the UK, a refugee is entitled to the same social and economic rights as any UK citizen, so refugees have full access to medical treatment, education, benefits, housing and employment. But despite this, there's still a number of inequalities that exist, including difficulties with adapting to cultural differences and barriers and understanding and speaking English, which along with various other factors leads to a number of issues in terms of being able to properly access employment, education, housing and healthcare. And when we look at the rights of asylum seekers in the UK in comparison with refugees, the situation is a lot more complex. So a person seeking asylum is someone who has asked the government to recognise their refugee status and is waiting to hear the outcome of their application. People seeking asylum do not have the same rights and entitlements as refugees because of restrictions applied under UK immigration legislation, rules and policy. People seeking asylum can access services in Scotland such as healthcare and education whilst they await their decision from the Home Office, but they cannot work, choose where they live or access a vast majority of financial benefits, including universal credit, and are provided with less than the sum of £50 per week for the purchase of basic necessities such as food, toiletries and clothing.
Thank you very much. And Ms. Dadge, if I could ask you then to come in with your contribution on this.
So in addition to what Anil said, which I would concur with, the difference with the areas that I worked in is that at that time, everybody that we supported came in through various UK resettlement schemes. And what the difference with that is that there's in each council area, the council will have accepted that person or family. They will have sourced somewhere for them to live. They will have checked in with the NHS and the police that there was capacity there for them to have support in those regards. So even amongst refugees, there's different kinds of support available. So as I say, everybody that we were dealing with in those days were under resettlement schemes. Now, in order to qualify for resettlement schemes, you're generally not in your country of origin. So, for instance, the Syrians would all have been living in refugee camps, sometimes for many years, before they were accepted onto a scheme and then accepted to come to Scotland. Sometimes you'd have people fleeing from a country like Sudan or South Sudan, and they would end up in Egypt, again, sometimes for many, many years, and living there in very unstable environments with no rights in that country. And in order, the qualification for the resettlement schemes differs from scheme to scheme. There was supposed to be a plan to make them all one resettlement scheme before the pandemic, but obviously that got derailed because of the pandemic. But all of the qualifications for the resettlement schemes differ slightly, but generally speaking, it's things like you've got small children, you've got a medical issue, you've been persecuted for your race or sexuality or something like that, or you've been the victim of torture, or a mixture of all those things. And those are the people that we supported during the pandemic.
Thank you. And just in terms of pre-existing inequalities, I think you mentioned that you concur with everything Mr. Bhopal had said. Was there anything else you'd want to add in terms of pre-existing inequalities of those you support?
No, exactly the same sort of things as Anil deals with, but I would say that in Glasgow and the west of Scotland and the things that Anil was dealing with, there's more variety, more complexity around the cases that he deals with. The people in the resettlement schemes, they got our support, but they also got support from various council workers. So even amongst refugees and people with refugee status, the kinds of support they can access differs quite a bit as well.
Thank you very much. The next broad theme we have is organisational adaptations and role during the pandemic. And if you could please describe to His Lordship things such as, for example, how your organisations adapted their service delivery during the pandemic and how their roles changed, including changes to the way of working, for example, moving to digital remote working, how you maintained engagement with the groups and individuals you support, and any challenges associated with these changes and adaptations given the types of services that your organisations provide. And if we could perhaps start with Ms. Dadge on this, followed by Mr. Bhopal.
So at the time of the pandemic, the staff, that was me and my co-worker, we already worked from home, so it wasn't too much of an upheaval in that regard. We had to stop. We have quite a lot of the volunteers going into people's houses to do support and to get to know a family. That all had to stop, obviously. And the volunteers then moved as far as they could to try and keep communication going through FaceTiming people, talking to them. Some people did practice with English with emails. Sometimes some of the volunteers would get maybe a cooking lesson from a Syrian woman over the line. Again, just trying to keep the communication going. We did welfare checks. We did food drops sometimes for them, but it was another way of just checking in that they were okay. They all had our phone numbers if they needed any extra support. As time went on, we tried to think of things to keep the engagement going, and that would be the vast majority of them were on our WhatsApp group. So we ran photography competitions and scavenger hunts and picture competitions. We did craft drop-offs for the children, things that they could make so that they could then, and then we would run a competition to see what they'd made. all of that was translated into the languages they use. At that point, there was a lot of mostly Arabic speakers, so that was all translated so they could understand what we were saying. And what else have I said? And then we also communicated some things about the pandemic as it was going along that we thought was vital. We did that often in conjunction with the councils, just to make sure that the messages were the same and they was kept as clear and as simple as possible. But that's basically how we moved it. We stopped any of the volunteers taking any of the family members to medical appointments because they still went on to some extent. And I did all of those. I took all of anybody that needed a medical appointment to in the car to do that. So those are the main things we changed.
Thank you very much. Mr. Bhopal.
Yeah, I mean, I think from an organisational perspective at the Scottish Refugee Council and also at WESREC, there was a bit of a culture shock in terms of having to adapt to a new way of working, similar to a lot of organisations up and down the country, of course, but a lot of us at the Refugee Council hadn't worked remotely from a digital working perspective previously, so adapting to using Microsoft Teams and Zoom and making sure you had the appropriate level of Wi-Fi in the house as well as PC equipment to work with was a bit of a challenge to begin with, and also similar to a lot of people, having to adapt to working from home will have been different according to your individual family life, and it would have been more challenging for some than others. But I think a particularly challenging role for a lot of colleagues within the sector that I work in and Rebecca works in is that our roles are very much front-facing, so we work at the heart of communities, and losing that face-to-face contact and social connection with people that we're used to seeing on a regular basis was difficult. And there's also a required sense of camaraderie, I guess, to keep ourselves motivated in such a challenging sector as well. So there's a tendency for a lot of us to have shared sets of values and beliefs, working towards a common cause. To lose that and not be able to lean on your colleagues for that sense of support was difficult. And also a lot of colleagues working in more of a casework setting and having to hear traumatic testimony from people who'd experienced trauma, as we've already explained, was difficult. Having to do that in isolation from their bedroom or living room with no support of colleagues or senior management to lend an ear. So that loss of close social networks in the workplace was difficult for a lot of people to adapt to, and I include myself in that category.
Thank you very much. This probably leads neatly on to digital inclusion, and has been touched on tangentially, but if you could please explain to His Lordship challenges faced by the individuals that you support in accessing and using digital technologies, and support provided in relation to those, or any other key issues in relation to digital inclusion. And perhaps we can start with Mr. Bhopal this time, followed by Ms. Dadge.
Yeah. So again, there would have been differences in terms of experiences between refugees and asylum seekers, but on the whole, a lack of access to suitable devices was a significant problem for refugees that we were working with during the pandemic, particularly at the start. And whilst access amongst this community in terms of smartphones was widespread, access to tablets and laptops and other devices was far more limited. And this will have affected parents and children's ability in particular to engage with schooling, especially when accessing online learning resources, but also adult learning was also affected. So a lot of the people that we support receive online support, receive ESOL support, and as that was being moved online, people were finding it difficult to access classes because of the fact that they didn't have the appropriate devices to receive the information on. And the situation was worse for asylum seekers in relation to each of those aspects. So as well as having limited access to devices, there was also very limited access to smartphones mobile data and also internet access. So the very basics of digital connection, really. So the Scottish Refugee Council, along with other charities supporting refugees and asylum seekers, were able to support the provision of digital equipment during lockdown, as well as support smaller organisations to deliver their services online. There was quite a few funds that came through, particularly at the start of the pandemic, which supported that means of work. And one notable example was Foundation Scotland's Response, Recovery and Resilience Fund, which provided just under £250,000 to the Scottish Refugee Council to distribute into communities to address digital exclusion and digital poverty amongst refugees and asylum seekers.
And was that being distributed to smaller grassroots organisations, or was that being used to fund to buy digital devices or airtime?
So, as far as I'm aware, money was distributed to smaller organisations. I think the exact number would have been around 57. That money was then used by those respective organisations to buy the necessary equipment, the necessary digital provision to then pass on to communities.
Thank you. Anything else in relation to?
No, that's everything.
Thank you. Ms. Dudge?
So very similar kinds of things to what Anil has just said. We, before the pandemic, gave quite a lot of people refurbished laptops that we got from various places, and they all started to, not all of them, but a lot of them started to break down. It was very difficult to get them fixed because there was nowhere open to get them fixed, although we'd found a way to do that to some extent, but it was becoming apparent that a lot of the laptops we'd given out were no longer fit for purpose. So this became a bigger and bigger issue. For us, getting funding for laptops took quite a while. It's hard to remember because it was a while ago now, but I think it was around about 9 months before that all started to happen, and we got quite a lot of funding for quite a lot of laptops from various places. I think that the third sector organisations managed a fund on behalf of the government for digital funding. I think we got some from Foundation Scotland as well. And then we started an exercise to see who had what laptops and who needed what laptops. And then at some point it became apparent that education departments were giving children Chromebooks. So we were able, with one of the local authorities we worked with, to figure out who had what in their house, so that we tried to make it so that people had enough to get online if they were able to. That only solved a bit of the problem though, because the biggest problem is the low levels of digital literacy, and even getting onto a Zoom call or something like that was very difficult for a lot of people who had never used a laptop. And as Anil said, a lot of them are very competent with smartphones because that's what they've used. A lot of time when they're in refugee camps, they'll still have a smartphone and they can use that, but using laptops is different. So when we gave out the laptops, we tried to come up with subjects that they would be interested in to get over that hurdle. Well, I have that as well. I don't want to learn any more technology because you think you just can't do it. So we did things that we thought would interest them. So like how banks work. A lot of our things in Scotland are very different from where they've come from, and that some of them are very cash-based societies. So we try to teach them things like how banks work, how current accounts work. Energy prices was a big concern when the energy prices started to rise. So teaching them a bit about that and how you save money, again, something that would interest them. So we started to do digital sessions. This is mostly with the adults, to try and get them to use the laptops that we gave out. So as I say, that all took quite a while.
And practically, if some of the people you're representing were digitally challenged, how did you provide the lessons? Was that via the smartphones, or were they?
No, what we did, normally we'd give a laptop and just say, that's your laptop. And what we did this time was, you can only have this laptop if you try and do these things. Before that, we put out a list of, these are all the subjects we're thinking about doing sessions on. What would you be interested in learning? And we did the sessions based on that. We worked with quite a lot of other organisations to deliver those, so like Energy Saving Scotland, for instance. we didn't really have an intention of taking the laptop back. It was just to try and get them to try to use their laptop. So we tried to use Zoom. We steered away from Teams at that time anyway. Zoom was a lot easier to use. Some of them had started to access it on their phone a bit when they were doing their ESOL lessons. So again, their digital literacy was getting a little bit better. So we tried to use that as a way of incentivising them to come on, try and use their laptop for other sorts of things. Again, trying to make it as simple as possible. So it would just be a screen. They had to click on the screen, and then there would be a presentation. You know, it was very, very basic stuff. There was no writing, there was no chat or any of that sort of stuff. So it was just information that we could provide them about different subjects of interest.
Thank you very much. If we could then move on to the next topic, which is really impacts on the people you represent, and it's really access to food and other essentials in particular. And this will cover as wide or as narrow as topics as you wish, but for example, financial issues, challenges in accessing food and other essentials, including culturally appropriate food, the support provided, any particular role of faith institutions in supporting communities in this regard, and any other relevant key matters in relation to accessing food and other essentials. And perhaps we can start with Mr. Bhopal.
Yeah, so I think the access of culturally appropriate food was difficult due to the travel restrictions imposed on people during the lockdowns. A lot of the people that we support are from the Muslim community, so being able to access halal food was an issue, and that's something which was supported by food banks and faith institutions up and down the country. But beyond that, there was also issues with people being able to access culturally appropriate food from various parts of the world. So, as you're all probably aware, there'll be hubs of areas within each of our bigger cities where people can access food, not being able to use public transport. To obtain that food was proving difficult, and again, that's where community initiatives and charities and food banks and faith institutions stepped in. We also found that a lot of people, again due to the travel restrictions, were unable to access cheaper food in bulk at cash and carries or supermarkets, so they found themselves paying a higher price at local convenience stores, which proved to be particularly difficult for people seeking asylum who, as I mentioned earlier, were already receiving a very low sum of money to manage their weekly food bills. Food banks, faith institutions and charities stepped up and helped to deliver culturally appropriate food packages to people's doorsteps. And I think it's something that maybe wasn't given enough recognition during the pandemic. There were a lot of local gurdwaras, mosques and churches in Glasgow, for example, that utilised their building spaces and worked in partnership with one another to obtain food, sanitary products and create packages to deliver to some of our most vulnerable communities, and I feel they should be commended more for that. And also there was a lot of very good online and mobile networking between charities to try and coordinate food support as well. So Interfaith Glasgow set up a food justice network which allowed people to coordinate support for people in particular need during the pandemic to receive necessary food items as well.
Thank you very much. Ms. Dudge, I'm not sure if this is relevant to the organisations or the communities you support, but do you have anything to add?
Just that before the pandemic, generally speaking, the Muslim families in our areas already travelled to Glasgow for halal meat. That was their biggest issue. They didn't like buying it locally. It was difficult to buy locally, and they didn't like the quality of what they could get locally. So that was their biggest issue, and it was quite difficult for us to find a way to help them with that. What we ended up doing was we got some money from, I can't remember where, I think it was from councils for food insecurity, and we got a local butcher to bulk buy in halal meat from Glasgow, which he agreed to vacuum pack into various packages for the families, and we ended up delivering them with a few volunteers locally, just doing doorstep drops. That was the major. Other things we certainly didn't hear that they were struggling with that. That was the biggest thing, and we were worried that they were going to continue driving to Glasgow when they weren't really supposed to try and get the food in the house that they wanted. So that's what we did around that.
Thank you very much. Unless either of you have anything to add in relation to access to food and other essentials, we can perhaps move on to the next topic, which is particular challenges for single parents or other vulnerable groups, including, for example, lack of support networks and flexibility, ability to access essentials due to childcare constraints or any other relevant matters. And perhaps we can start with Ms. Dadge first on this one.
Yeah, there was a couple of incidences during the pandemic around single parents, which I thought were quite challenging. This wouldn't have just applied to refugees. I would imagine this applies to other single parents, but they had particular challenges in addressing it. So, for instance, we had one woman who, a single parent, she's a diabetic. She was struggling to get the medication she needed in the time that she needed it. There was something going on at the time with both her GP and her pharmacy, so it was all a bit. There was quite a few. She needed the meds that day. The deadline was that day when she needed them. The supermarket where she got her, that had a pharmacy where she got her medication, wouldn't let her in the supermarket with her children. And of course she's here on her own with no kind of wider support network or such, so there's nobody who could hover outside the house keeping an eye on the children, nor can she take them into the supermarket. And it just seemed like she's stuck in a place where she's got no solution to get the medication she needs. She was hospitalised a few times because of her issues around her diabetes, so that just seemed quite strange to me, and it was quite difficult to find a solution to that. I think what happened was I ended up going in to get her medication for her. The other one was a woman quite early on who it sounded like she had COVID. She's a single parent of 2 little girls, and she was quite sick. She had about 3-4 miles to go and get tested, and she couldn't take the girls with her. She couldn't leave them at home. Taxi didn't want to take her because she was so sick. She wasn't keen on getting on a bus because she was so sick. She couldn't really walk the distance because she was so sick. And it just seemed to be that there was no solution offered for that kind of situation for single parents, which just struck me at the time as quite a gap.
Particularly, as you say, if it's a single parent with no other support due to their circumstances.
Not like people who have friends. I know that you weren't supposed to go into other people's houses at the time, but I'm presuming other people found a way around it. At least they could be in the vicinity and keep visual eye on the children, but they don't have those kind of networks. So again, I just thought that was a bit of a gap there.
Thank you. Mr. Werpel, I don't know if you'd like to come in on this topic, and not necessarily in relation to single parents, but any particular groups of those you represent, subgroups of those you represent that had particular challenges.
I think just using that example of single parents that Rebecca's touched on there, I guess those examples there help to lay bare those existing inequalities that already were clear to see pre-pandemic, that affected many of refugees and asylum seekers that we were working with. So a lot of people come to this country obviously with a very limited awareness of how culture works and how to communicate effectively in terms of being able to speak English at a certain level, but also a real lack of support networks and social connections which they can lean on in times of adversity. And those issues were clearly exacerbated during the lockdowns and would have had particularly detrimental effects on single parents, single people living alone, younger people, older people. So I guess intersectionally we can see how people of a particular background and living within particular circumstances are more affected than others. Yeah.
Thank you. The next topic on my list is one I think I forgot to highlight when I read out the list, and I think it's something perhaps, Mr. Bopal, we can start with you. It's housing, homelessness and related issues, including, for example, access to housing, particular challenges faced by asylum seekers living in hotel accommodation, for example, challenges in accessing food and other basic necessities and services, some of the issues we've already spoken about, support provided to those, and any other relevant key matters. So if I could invite you, Mr. Bopal, perhaps to start speaking about those issues.
Yeah, I mean, part of my role during the time was supporting asylum seekers that were living in hotel accommodation. So, I mean, from testimony and from what I've heard from colleagues who were working more directly with people living in the hotels at the time, they were under particular stress and isolation, so having to be cooped up essentially in a hotel room for 23 hours of the day is unimaginable for a lot of us. I mean, you consider the level of trauma that people will have experienced before coming to the country, and then being forced to be left alone with their thoughts in an isolated space with very limited means of communicating with the outside world. It's obviously incredibly challenging, and doing that with limited monetary means, limited access to the outdoors, limited access to technology. Those issues only exacerbated the situation for a lot of people. So, severe mental health issues were obviously experienced by a lot of people that were having to live in hotel accommodation during the pandemic, and many of the asylum seekers that I was in contact with and colleagues that were in contact with after the Park Inn incident in July 2020 commented on how that made things even more difficult for them. Not just because of the scale of what happened and the worry and the anxiety associated with the fact that something similar could happen to them in their own accommodation, but also the worry of public outcry and the further scapegoating of a community that have already been tarnished with a certain image by some of our politicians and media. So yeah, a very difficult time for a lot of people living in hotel accommodation in particular, and it really again helped to highlight those pre-existing inequalities in the sense that these were people that were already very vulnerable to poorer mental health than the average population, and this brought those issues to the fore even more clearly, and the increased isolation and loneliness and stress and anxiety brought on by the lockdown and having to live in such a confined space, again, exacerbated that.
Thank you, Mr. Bopal. And you mentioned, thank you, that mental health, welfare and isolation. That we've heard a lot about this across wide groups, and obviously, as you said, it's exacerbated and more pronounced for people with pre-existing inequalities. To what extent were those issues felt by the wider refugee and asylum-seeking community that you represent, not just those in hotel accommodation?
Yeah, I mean, it would have been a different situation, but again, very difficult. I mean, I talked about those various traumas that people come to our country with. So having to manage those during the lockdown would have been difficult in itself, especially when you lose that social support. So, like with everyone, we had limited access to who we could speak to directly in terms of family and friends, but a lot of the refugees that we support with rely on community support, whether that's through ESOL classes, community cafes, health and wellbeing activities. All that was put to a halt, and not having that face-to-face contact seemed to exacerbate pre-existing mental health, physical health issues, and obviously the sector did try, and I believe did a good job of adapting to delivering work online to try and alleviate some of that loss, but it still wasn't the same. So still very difficult for a lot of people from a refugee background, but when we compare it to the situation of asylum seekers living in hotel accommodation, the situation was a lot worse there, obviously.
Thank you very much. Ms. Dadge, I think you'd mentioned right at the start when speaking about what your organisation does, befriending services. To what extent were mental health and well-being and social isolation issues for the communities that you represent as a consequence of?
It certainly wasn't as severe as the things that Anil experienced. The housing's already established because they are already accepted by the councils. We didn't at the time have too many people living on their own. There was a situation where a couple arrived with a baby, and then the man left the home, and she had just arrived in the country at the start of the pandemic, so she was on her own. But we found ways to keep connection with anybody in that situation, either by visiting them outside the home, making sure that they had company at some point in the day, and the volunteers worked really hard to keep in connection with the people that they were befriending. A lot of the people that we have were families, though, with a lot of children, so they didn't experience isolation in that same way. So the few that we did have like that, we were able to make sure that we were keeping an eye on those. And we also, particularly with one of the councils, have a very good relationship with the council, so anybody that they were worried about or concerned about, we would talk about that and try and find ways to make sure that they weren't left on their own too much and that somebody was checking in with them regularly.
Thank you. Well, that leads us neatly on to the next topic, which is communication of pandemic information. If you could please just explain to His Lordship any issues that were experienced in relation to pandemic information, for example, access to information, methods of communication, any cultural differences, language barriers, literacy issues, or any other relevant key matters in relation to pandemic information. And when I say pandemic information, I'm talking about, for example, rules, regulations and guidance that were being issued around that time. And perhaps we can start with Ms. Dadge and then followed by Mr. Bhopal.
I think probably one of the things that puzzled me the most would be if one of the refugees got a notification on their phone that their test had proved positive. That was given in writing in English. As far as I know, there was no way, or there was no other communication given to them, and as far as I know, none of the NHS staff were, even though they would have seen that person and been aware that they didn't speak very good English, to make sure that they understood what was trying to be communicated to them, and that seemed quite counterproductive if you're trying to stop the spread of a disease. I have a general thing about the way that a lot of agencies communicate to people, not just people not speaking English well or as a second language. There's all other kind of people that have literacy issues or barriers, and it seems to me we have a lot of ways of communicating now, and they still stick to the written English. And I think that they should generally be a bit more imaginative about how they try and communicate things. And that was the biggest thing for us. There was no kind of, I know it's difficult with private information, but there didn't seem to be any reaching out from GPs or the NHS testing centres for other organisations to make sure, can you make sure that this person can find a way to understand this message, even if they weren't able to give it to them in their own language. We have quite a lot of people that have no literacy even in their own language. So, as I say, as far as I know, though, there was no kind of other way of making sure that those people understood what was trying to be communicated to them all through the pandemic, as far as I know.
And you mentioned earlier that you obviously were quite a small organisation. I think you mentioned 2 staff members, but you had a number of volunteers. How did you find the accessibility and clarity of the guidance that was coming out that might have applied to your volunteers in carrying out their role? Was that an issue or not for your organisation?
That was all fine, and the Scottish Government information, as things changed and rules changed, I found it quite easy to find this is what you're allowed to do and this is what you're not allowed to do. All of our volunteers are English speaking, so that's not an issue for them. So it was really rules for them about what they could and couldn't do, but that went out through our regular newsletter, and that was fine. We did, as far as possible, try and get them to also communicate with the families about what was going on, because they were in more regular contact with them and they had ways of getting their point across even if somebody didn't speak much English. The councils obviously helped with that as well. In Stirling Council, certainly, there was a person, the main officer there speaks Arabic, which is also hugely helpful. So he can put things out. If we were communicating anything about about COVID itself through our own WhatsApp groups, we always got those translated into Arabic. And for those families, we knew there was no literacy of any kind, so they wouldn't be able to read that even in Arabic. We found somebody that spoke their language to phone them up and tell them what that said and what the guidance was. So that's how we managed it. And those, at that time, we didn't have such huge numbers of those kinds of people that made it impossible. I would imagine in areas like Glasgow, where they're dealing with a much more varied, that was much more challenging. For us, that wasn't too bad, though. We managed to do that in every instance, as far as I can remember.
Thank you very much. Mr. Burpal, I could invite you to come in relation to communication of pandemic information and any particular issues that those you represent experienced.
Yeah, I mean, I think there was generally positive feedback on what the communities received in terms of accurate information on COVID-19 and adhering to restrictions, etc. And that included information provided through the Scottish Government, through information that people were receiving online, through news services, etc. And I think that could be backed up by the sense that there seemed to be generally a high level of compliance with public health measures, and that was outlined by a survey that the Scottish Refugee Council undertook with a select number of participants from a refugee background between March and August of 2020. So yeah, generally I think the feedback was that most information that was provided on COVID-19 was relatively easily understandable, and I think that's testament to the quick and good work that public agencies did during the pandemic and did during a time where they wouldn't have any real sense of precedence in delivering that type of resource to communities. So good number of resources with translations produced in various languages. There seemed to be the simplification of language to get core messages across to communities in a straightforward manner. Public agencies seem to have latched on to the idea that visual images and videos are good in terms of getting targeted messages across to people with limited English, and this information seemed to be distributed well, both physically and digitally, throughout Scotland. And in terms of my own personal experience of working with public sector organisations, not only with the Scottish Government, good in terms of reaching out to ourselves and seeking advice on how information should be prepared and who it should be communicated to, but likes of the NHS and Police Scotland also seem to up their game in terms of reaching out as well and producing stuff that was more accessible than it had been in the past. So overall good feedback. Of course things can be better and be improved, but the situation was unprecedented, so aye.
Well, thank you very much. Unless either of you have anything else to add in relation to communication, we can perhaps move on to our next topic, which is collaborative working and community connections. And I think you've both touched on this in passing, but if you could just explain a bit more to His Lordship about how that worked in practice for your organisations, including, for example, collaboration amongst third sector organisations, yourself and other third sector organisations, availability of other services, both third sector and public, collaboration with local authorities and the Scottish Government, and any other relevant key matters in relation to collaborative working and community connections. And if we could perhaps start with Mr. Bhopal, followed by Ms. Dodge.
Yeah. So luckily enough at the Scottish Refugee Council, a year before the pandemic, we'd set up something called New Scots Connect, which comprised an online forum, an online map, and a team of 5 regional coordinators working across the country to act as the link between communities, the public and third sector, and those supporting refugees, asylum seekers and new migrants. So the fact that that had been set up proved to be a real benefit during the pandemic. The online forum allowed organisations or anyone working with refugees, asylum seekers and new migrants across the country to share information, knowledge and learning. So any information or good practice on what was being done well within communities in the Highlands, for example, could be shared with groups working in Edinburgh or Glasgow, and that was all done via a very simple to use, straightforward online forum. The forum was also accompanied by a map which indicated who was doing what in particular areas in terms of support for communities. So if we were working with the likes of Police Scotland or the NHS, we could direct them to this map. They could then simply plug in a postcode and then locate what group was doing what in which area. So a very efficient and convenient way of working during a time when key public sector agencies such as the NHS and Police Scotland were looking to work with people quickly. As I mentioned, there was 5 regional coordinators who effectively acted as officials covering the entirety of Scotland and acting as a link between communities and the public and third sector. So I covered the southwest of Scotland, which included 9 local authorities, but the remaining 23 were also covered by 4 of my other colleagues. So they acted as a conduit between refugees, asylum seekers and faith institutions, local authorities, businesses, higher education sector, charities. So that package as a whole acted as a really effective tool, I believe, for supporting communities during a especially difficult time. I think also there was improved partnership working across the sectors and within the third sector as well. And I guess that really demonstrated that when backs are against the wall and when we are in a state of emergency, barriers tend to come down, and I think that's the way that we should look at things moving forward. And the pandemic really demonstrated that great things are possible if those parties, third sector, public bodies, work together more efficiently all the time. And I think overall the speed of adaptation of service delivery again proved testament to the resilience of the charity sector as a whole. Yeah.
Thank you very much. Ms. Dodge.
In my area, one of the particularly helpful things that happened was the third sector interfaces, known as TSIs. Very early on, I think pretty much shortly after lockdown first started, is they invited all the charities in their area to come onto a call, and that varied in the 2 areas between 30 and 50 organisations, and we were able to talk about what we were doing, what our plans were, what if anybody had any issues or concerns, and the scope and reach of those organisations was amazing, actually. Both of the areas that I worked in have quite big rural parts, so there was a bit of concern that there was going to be people in areas that you wouldn't know about, but the amount of organisations and the people that they knew, it was down to street level in terms of people that needed help and how they were trying to support them. So that was very reassuring for me, in the sense that if I couldn't get something, say a prescription or something, to somebody in a particular area, I had any number of organisations that I could tap in to make sure that was done for that person. as it was, I didn't have to use that too much, except on a couple of occasions when there was a bit of a shortage for diapers at one point, there was a bit of a shortage for formula at one point, and there was a few families struggling to get these items, and I was able to get to tap into to get those through the food banks in one of the areas. That was really helpful, and the TSIs were very helpful if I ever had any questions about what was happening. The other good thing that happened about that in terms of the public and charitable sector, as Anil said, in both of those situations somebody from the council sat in on those talks, and often that person would chip in and tell you about services or funding that was becoming available because of COVID, and you could tap into that person that had held that budget. So I think, if memory serves correct, for instance, we got some quite quick money for food drops for people to try and sort out the halal meat situation. So all of that worked pretty well and pretty quickly, and it, as Anil said, it was incredible to watch it actually, the scope that the third sector had about delivering support to people in need.
Thank you very much. I don't know if either of you have any particular things to say about your engagement with the Scottish Government, whether you sat on any, or your organisation sat on any groups, but now would be the opportunity just to highlight how that worked, or if there were any issues or room for improvement on that communication with the Scottish Government.
Yeah, I mean, I think there would have been more senior management level engagement with officials at Scottish Government during my time there that I wasn't involved with, but I had a couple of very good links with some key officials within the Scottish Government at the time, and we were in regular contact about how to produce marketing material and improve outreach and engagement with communities, and that was something that in my experience hadn't existed before, so to have had that link during such a crucial time for our communities was very useful and very helpful, and yeah, it proved to be incredibly fruitful in terms of getting key messaging out to people, and it's a relationship that's thankfully continued between the Scottish Refugee Council and the Scottish Government, but also beyond that. So again, I guess that can be seen as another positive example of something coming out of a very difficult situation.
Thank you. And Ms Dadge, anything that you'd like to add to that?
As far as I remember, we didn't have any direct contact with the Scottish Government. I think all of the messaging around that, apart from what you could access directly, would come through the Scottish Refugee Council for us. So any messaging that they were sending out would come down to us. But not that I can remember. I don't think we had anything direct.
Thank you. Well, if we can then move on to the next topic, and I think it's possibly the penultimate one, which is financial support. And if you could please just highlight for His Lordship any issues or positives around accessibility of funding, speed of funding, flexibility of funding, the role of large organisations as conduits to reach smaller groups in relation specifically to funding, challenges in connecting with harder to reach communities, and any other relevant key matters. And if we could perhaps start with Ms Dadge and then Mr Bhopal.
In terms of our own funders, so Foundation Scotland, Community Fund, that kind of thing, we have had a bit of a mixed bag of funders. They were all extremely proactive in speaking to us right early on in the pandemic, in the sense of they would email to say, if you need to spend the money differently than you've envisaged it when we gave you the money, just go ahead and do it. You don't have to ask for permission. Some of them would say, oh, I know you'll be writing a report, an impact report for the Community Fund. You can just give us that same report. You don't have to write something different. I've worked in the charitable sector for a long time, and that was quite new and different, and it was very welcome. Very easy to speak to them if you had any questions. Other kinds of funding, like the digital funding that we talked about, I think was quite slow to come, given that somebody somewhere must have realised that this was what was going to happen. Well, I suppose they didn't know how long it was going to last, but it became apparent that the digital isolation issue was going to be huge. So that, as I said earlier, I think took at least 9 months to come through to us to be able to afford laptops and start giving them to people. And again, as I said before, that was only half the battle. Sometimes I got a bit of an impression that the funders thought, oh, well, we've given you enough money, everyone's got a laptop now, job done. And that's just the start of a very tough mountain to climb with some people, myself included sometimes, but learning how to use those tools correctly. And also, if you're trying to teach somebody how to learn a laptop remotely when they have very low digital literacy, it's a real tricky thing to try and achieve. So those I think were the big issues. Other smaller bits of funding that we got from the councils, some of that might have been coming through the Scottish Government for like food parcels and things like that. All of that was quite quick and easy and pretty straightforward to access. So I didn't have any issues with any of that sort of funding.
Thank you very much. Mr. Bhopal.
Yeah, I mean, I guess I'm working directly within the Refugee Council. I got to see firsthand how quick a turnaround was produced in terms of securing a release of funds into communities. So a lot of funding during those first 6 months of the lockdown was largely distributed by the Refugee Council through money provided by various sources, including the Scottish Government, the Asylum, Migration and Integration Fund, which came through the European Union, and also the likes of Cora Foundation and Foundation Scotland. There was a lot of support in terms of administering the funding as well from other grant providers and charities, including the National Lottery Communities Fund, and it seemed to me, sitting on the other side of the fence at Wesrick at the time where I was trying to secure funding myself, that grant providers seemed to make the application process more simplified to allow for quicker applications to be produced, and there also seemed to be a flexibility of funding available to allow for a wide range of themes to be explored. So organisational priorities would have differed according to where they were based and who they were supporting, and that was taken into consideration, I believe, by a lot of the funders at the time. So whilst there might have been charities that would have seen digital poverty or food poverty as being a priority, there would have been others that would have perhaps viewed social isolation and loneliness as being more of a pressing issue, and that was considered broadly by a lot of funders.
Thank you very much. Before we move on to our last theme, which is really an opportunity to provide any suggestions for potential lessons, I'd like to give you both an opportunity, if you'd like to take it up, just to highlight to His Lordship any other key issues that we've not touched on today. We've obviously got the roundtable report, and all of that will be taken into account, but if there's anything else you'd like to flag up before we move on to lessons learned, please feel free to do so now, and that can include ongoing issues or impacts as well. So I don't want to put you on the spot, so I don't feel you have to answer, but if there's anything you'd like to flag in particular, please do so.
Well, sort of goes to the last point we're going to get to when we were talking about the communication around COVID. What was in some of the refugee communities, because they couldn't access the information in a way that they could understand, the rumour mill started amongst them. Misinformation started to swirl amongst them about how dangerous it was or wasn't, and it seemed to be a bit of a rise in people not believing that it was such a dangerous disease. And I think if the communication had been provided in a more variety of ways that people could access it, maybe the government could have combated that sooner. As it was, the Scottish Refugee Council started to do some small films with people speaking different languages to sort of say, I know what it was. It was about resistance to get the vaccine. That was all sort of swirling around. The Scottish Refugee Council did eventually do some films about that, but it was quite late on. And it just seemed to me, if the communication had been provided in a more accessible way to more people, that they might have been able to head that off a bit before it got a lot of people not taking the vaccine because of that misinformation swirling about.
Thank you. Mr. Bhopal, anything particular you'd want to flag that we haven't touched on already?
Nothing for the moment.
Okay, thank you. Well, then, if we could move on to our last theme, which is potential lessons to be learned, and if I could invite you both, based on the experiences of yourselves and your organisations during the pandemic, if you could perhaps provide suggestions to His Lordship for what the Scottish Government could do to mitigate any ongoing impacts of the strategic response to the pandemic on the communities you represent, or could do differently to improve matters in the event of another pandemic or similar emergency. And perhaps I could start with Ms. Dodge and then end with Mr. Bhopal.
Well, I'm just going to be repeating myself, I'm afraid, Laura. So it's really, again, just about a communication. It just seems to me that we live in a time where there are many, many ways we can communicate now. We've got voice notes, we can make little films, we've got AI that can make quite fancy things in different languages, presumably. And yet it seems that we go back to written English over and over again. And I just think that that's not the way to communicate, and we should be using a much more variety of platforms in different languages, different visual images, different ways of communicating same thing to different people, and that's very accessible and easy for them, using the tools that they're familiar with, so that they can get that information on smartphones rather than laptops and all that kind of thing. And I don't just mean that for pandemics, I mean that for across the board public information that's useful for people they're dealing with. You know, it's hard to imagine somebody coming into a country where every single thing they hear and see is different from what they saw and heard yesterday. And there's so many more ways that we could make that easier for people to understand. And I think that's a lesson to be learned, not just for pandemics, but for day-to-day life.
Thank you very much. Mr. Bhopal.
Yeah, I mean, for me, I think keeping up that level of engagement with communities who have lived experience of issues that people are looking to address is imperative. So government officials working more directly with not just senior management teams or policy teams within charities, but also people working on the ground at a grassroots level to seek direct advice and guidance and support on how to best engage and reach communities. I think for me that's a key priority for anything that may happen again in the future in this vein. And also public sector bodies in general, I believe, should have more of a positive attitude and not be scared to engage directly with third sector organisations working on the ground. I don't know whether there's a bit of a stereotype associated with organisations working with minority ethnic communities, including refugees and asylum seekers, that there could be barriers in terms of reaching out to them, whether that be cultural or linguistic, and that could and has potentially in the past acted as a deterrent to any potential partnership work being formed. But I think the lockdown's proven that that clearly isn't the case, and there isn't any reason for officials from the public sector not to reach out to us directly and seek our support. And also touching on what Rebecca's just discussed there, continue to provide accessible information in different formats and listen to the communities that you're serving. So produce stuff that's linguistically, culturally and visually appropriate. And I understand as well, of course, that immigration's a reserved matter for Westminster, but if there's any possibility or opportunity for Scottish Government to keep up pressure on the Home Office and policymakers to recognise that those living in unsuitable accommodation and living in enforced poverty can be justified at any time, especially during extreme situations such as a worldwide pandemic, when some of our most vulnerable people are already suffering from a multitude of issues, most notably those relating to mental health.
Thank you both very much. My Lord, I don't have any further questions unless your Lordship has anything to ask.
Nothing I want to say, thank you very much indeed. All that remains for me to do is to thank both members of the panel today for their attendance and for the evidence they gave. But that brings today's proceedings to an end, and we return tomorrow for the last of the hearings in this particular portfolio at 10 o'clock. So thank you all until 10 o'clock tomorrow morning.
Thank you, my Lord.